slideshow when we get started. So because otherwise I can't see the screen.
Okay.
Okay, I think we're ready, Kathy.
Okay, so, well, good afternoon, everyone. This is our second part of the Olmstead discussion. I again would like to thank Melanie Davis from the University Center for Excellence in Developmental Disability for helping me in the background. I would like to acknowledge all the groups that I have been involved in planning these monthly sessions. That's the League of Human Dignity, Independence Rising, Easter Seals in Nebraska, the Madonna School and Community-Based Services, APSI in Nebraska VR, ADAPT Nebraska, Integrative Transitions, Nebraska Family Support Network, Nebraska Statewide Independent Living Council, Disability Rights in Nebraska, University Center for Excellence in Developmental Disabilities at Munroe-Meyer Institute, Nebraska Council on Developmental Disabilities, People First of Nebraska, the ARC in Nebraska, Harper Self-Directed Services, Brain Injury Alliance, Assistive Technology Partnership, Outlook Enrichment, and PTI Nebraska. Just like a few housekeeping rules to go over before we get started. Depending on the device you're using, your toolbar may be at the bottom or at the top of the screen. So there should be a participant, a chat, and a Q&A. And if you have a question, you put it in the Q&A box. But I'd like to encourage everybody, feel free to put something in the chat about yourself or what you think of the program. There is a list of keystrokes for Zoom that is available in the Dropbox. And I believe Melanie has put the link for the Dropbox there. All of the PowerPoint presentations that we will use today are in the Dropbox already, or any other material that speakers might feel is important. As always, there will be closed captioning available. You turn it on by clicking the little arrow beside the CC button, and then a toolbar will come up, and you just say Enable Subtitles. And at this time, I would like to turn it over to Mark Smith, who will be our moderator again today.
Thanks, Kathy. Good afternoon, everybody. Welcome to Friday afternoon. That's a reason for celebration in and of itself, but also welcome to this presentation. I think you're in for a real treat today. We have 3 presenters that'll be discussing their role in the development of the Nebraska Olmstead plan that was so well laid out yesterday by Diane Dallaire in her presentation. I do want to emphasize that materials are in the Dropbox link that Melanie has put in the chat. Diane had a couple of items that weren't able yesterday during her presentation, if you were in attendance at that didn't come up, embedded links in her presentation. And so that material is available there for you if you are interested in it. Believe me, I think after you hear our presenters today, you may want to go in there and maybe take a look at a few of those items. And so just a couple of ground rules, as Kathy mentioned, please, if you have questions, put them in the Q&A, and I will ask questions of the presenters probably at the completion of each of their sections. But feel free to use the chat to talk to each other, talk to us. That's just perfectly fine. A little bit about myself. I'm a faculty of the University of Nebraska Medical Center at the Munroe-Meyer Institute. I'm funded primarily under the University Center for Excellence in Developmental Disabilities grant. And we are primarily focused on building the capacity of our services and systems for people with disabilities for the state of Nebraska. We have state responsibilities. Even though we're located in Omaha, believe me, there are a lot of folks out there with our flag that are doing work on behalf of our community of people with disabilities. But along with being capacity builders, we also have other requirements like, for example, policy and advocacy. And so I've had the great privilege of being involved with the development of the Nebraska State Olmstead Plan, and will continue to do so. The last thing I want to add is that in addition to my day job, I'm the parent of a young man with intellectual and developmental disabilities, as well as a sibling to a person with intellectual and developmental disabilities. So for me, this is my work, but also my life. So in any case, I'll briefly introduce our presenters and then we'll get started. Our first presenter is going to be Joni Dulaney, who works with the Nebraska Planning Council on Developmental Disabilities. They've had a key role over the last several years in the development of the Olmstead Plan for Nebraska. Our second presenter will be Tom Arnsbarger. He's a senior legislative aide to Senator Lynne Walz, who, for those of you who don't know Lynne, she's the state senator for the Fremont area of Nebraska. Tom, as her administrative person, he can describe that better than I. And Lynne have also been key in the development of the plan. And then our last presenter will be Director Tony Green, the director of the Nebraska Department of Health and Human Services Developmental Disabilities Division. Tony has had and will continue to have a key role in the execution of the Nebraska State Olmstead Plan as it now stands. As we discussed yesterday, the plan is not intended to be a static document, but a live document. And so there will be ongoing work related to improving the plan in terms of documenting progress on the plan, in terms of identifying other areas and concerns on the plan. So I have a sense that Tony will have a lot to say about that. So without further ado then, I'm going to introduce Joni Dulaney, and I'll be doing Joni's slide. So you'll be hearing Joni saying, okay, Mark, and let me get started for you, Joni. And welcome.
Thank
Really
you. I'm glad to
have you here.
I'm glad to be here with you all today. As Mark said, my name is Joni Dulaney. I'm the program specialist for the Nebraska Council on Developmental Disabilities. And I would put a little jab at Mark and say, when he introduced us as the Planning Council, we actually removed the word planning from our name. a while back, but that's okay. I still catch myself almost saying Nebraska Planning Council as well. So
I stand corrected. Thank you, Joni.
just in case people are trying to find us, we're the Nebraska Council on Developmental Disabilities. And the council is federally mandated. We're an independent council comprised of individuals and family members of individuals with developmental disabilities. Our council also includes community providers and agency representatives who advocate for systems change and quality services. Our members are all appointed by the governor, and we currently have 25 members on the council. We are housed in the Division of Public Health in the Nebraska Department of Health and Human Services, where we receive our funding through the Administration for Community Living in the U.S. Department of Health and Human Services. So Mark was saying that he's a representative of the Munroe-Meyer Institute and the University Center for Excellence in Disabilities. And yesterday when Diane Dallaire was talking, she represented Disability Rights Nebraska. The council is the third member of what is referred to as the Developmental Disabilities Network. And this network is defined in the DD Act. Today, I'll be talking about the role of the council in the development of the Nebraska Olmstead Plan. There are dates and legislative bills that I will touch on, but I'm going to leave most of the legislative history to Tom, who will be presenting next. There are a couple of bills and dates that are important to the council's role that I will reference.
Go ahead, Joni.
I can't see.
Okay. I'm sorry, a little bit of fighting it.
We'll just do it this way, Mark. I'll pull it up.
Can
Here.
you now?
Yes.
We got it?
Yes. Is there another way to view that so we don't see the notes?
Sure.
Maybe start it from beginning up there in the top left corner.
That's what I'm trying to do.
All right.
And I'm having, okay. Apologies, guys. This is not making it easy on me. I have lost my camera. Okay. Okay, getting closer. I apologize for the delay, but I think I can get us there. Okay. Share. And are you seeing it now?
Now
Yes.
we do.
Very
There
good.
we go. Very good. Thank you, Mark.
Very good.
All right. The Nebraska Olmstead Plan began when legislation was introduced in 2016, and that was signed into law. In 2018, 2 years after LB 1033 was passed, there were still gaps in funding that stalled the development of the Nebraska Olmstead Plan. Another bill was introduced to provide additional weight to the plan. Unfortunately, that bill was indefinitely postponed. At our quarterly meeting in May of 2018, at our council meeting, we were discussing the status of the Olmstead plan and the funding gap. The council, after much discussion, decided to approve funds of $127,000 to be used by DHHS to hire TAC, which is the Technical Assistance Collaborative, to develop the Nebraska Olmstead plan. Utilizing the council federal funds on the TAC contract furthered progress on the council's state plan goal of community inclusion. Next. Using the council funds, DHHS entered into a contract with TAC, and that contract was for July 18th through December 31st of 2018. TAC began the Olmstead plan work in August of that year, and the initial contract had 3 phases. Phase 1 was an environmental scan, data analysis, and planning. Phase 2 included meetings with state teams and stakeholder advisory committee members and conducting listening sessions and stakeholder interviews. And finally, phase 3 would be to produce the final Olmstead plan. Next. So TAC shared the draft framework of the plan with the Olmstead Planning Advisory and Steering Committees in December of 18. And the framework areas included are listed here. There was a reduced reliance on institutional settings, diversion from segregated settings, including jail and prison and homelessness, an increase in affordable and accessible housing, an increase in home and community-based services, integrated employment, transportation, human resources and workforce, and data collection, evaluation, and quality improvement. Next. DHHS noted in the legislative December 2018 Olmstead Plan Report that TAC provided a proposal recommending a new contract with a cost of $37,200. This new contract would allow them additional time to provide a complete Olmstead plan. DHHS did extend the contract through March 25th of 2019, which was the maximum amount of time allowed per law, in order to continue the plan development. The report also noted that DHHS could not provide a comprehensive Olmstead plan without additional partners and time. By March 25th, TAC provided a guidance document to DHHS that contained recommendations and components to include in the Nebraska Olmstead plan. And it was this document that serves as a draft framework for the Olmstead plan. It was not the final Olmstead plan, but the draft framework for the plan. Next. In January 2019, LB 570 was introduced to address the remaining funds needed to extend the due date of the plan and to strengthen the involvement from other areas of state government so that it didn't all just fall on DHHS. Advocates worked to educate and inform senators to pass LB 570 in order to complete the strategic plan process. The bill passed and was signed by the governor in May of 2019. Next. DHHS entered into a new contract with TAC to complete the Olmstead plan. And under this contract, there were several things that TAC would do that include host meetings with the Olmstead Steering Committee and the Olmstead Planning Advisory Committee, refine and prioritize goals, strategies, and measures with DHHS divisions, meet with partner agencies and departments to establish the plan's goals, strategies, and measures, prepare the draft plan for DHHS and partner agencies to review, revise the draft report to the Stakeholder Advisory Committee, make revisions and submit the final plan to DHHS. And on December 13th, 2019, The DHHS CEO submitted the plan to the legislature. Next. There were a variety of resources that TAC used to gather the information, and that included researching and reviewing more than 90 documents and data sources. They held 6 listening sessions, as you can see, across the state, and they conducted 40 interviews with the groups that are listed here on the slide. Next. There were some broad themes that came out of phase 1 and phase 2 that identified some critical guidance in creating the Olmstead plan. So they looked at identification of existing programs and services that support integration, identification of existing strengths that can be expanded upon or used as a starting point for the Olmstead plan and framework, identification of gaps in community-based service array from across DHHS divisions, the lack of affordable and accessible housing and transportation, the use of data for quality improvement and service development, interdepartmental collaboration and partnerships, and shared goals around community-based services and programs, the workforce shortages and providers, financing considerations for changes in services over time, statutory, policy, and/or regulatory changes and other recommendations that may be low-cost ways to get started, the role of leadership, and very importantly, the support from the legislature and the governor. Next. This is a time frame or timeline of activities that TAC would undertake. So in December of 2018, DHHS submitted the Olmstead Plan Progress Report to the legislature and governor. In March 2019, TAC released a 2019 Olmstead Planning Guidance document that established a roadmap for the Nebraska Olmstead Plan. From May to August of 2019, they met with partner agencies and departments. And on December 15th, 2019, the strategic Olmstead Plan was due to the legislature and governor. Between June 1st and December 31st of 2020, the agency began working on goals and objectives. And it's important to note that the Olmstead Plan work is based on the state fiscal year of July 1st through June 30th. In December of 2020, TAC issued a report with recommendations. The prepared draft report was submitted to the steering committee for review and feedback, and the final report was issued to the steering committee on December 31st. So now we're in the January 1st to June 30th timeframe, and work will continue on year 1 of the Olmstead Plan. And by December 15th of this year, a progress report will be submitted to the legislature and governor. So that gives you a time frame reference to see how much work has been done and the basic timeline for when it was happening. Next. And as Mark said, and was said yesterday, it's important to remember that the Nebraska Olmstead Plan is a living, evolving document that will continue to be refined. And advocates will continue leveraging efforts for legislative oversight and ongoing progress on the ever-changing Olmstead Plan. Next. One thing that people may not realize is that TAC has already done work previously in the state, and so they're familiar with Nebraska. In 2016, they worked with the Division of Behavioral Health on a supportive housing plan, and this slide just gives you a little more information about that. The work was to develop and align the DBH, which is the Division of Behavioral Health Policy to promote supportive housing and community integration as two foundational aspects of the behavioral health service system, to define and establish a supportive housing pipeline over the 3 to 5 year time frame, ensure that effective and evidence-based practices and services are available to promote successful tenancy and community integration, to establish suitable funding sources for supportive services to individuals living in supportive housing services or settings, and to strengthen the workforce capacity. There's a link here that you'll be able to access if you download this presentation that will give you more information on that plan. Next. So as we said, this is the Nebraska Council on Developmental Disabilities. Our executive director is Kristen Larson. And this is her contact information as well as mine and our link to our council webpage. And that's all I have for today. You're on mute, Mark. Mark, you need to unmute. There you go.
Yeah, no, I'm here.
All right.
The Q&A covered my slide. So questions for Joni with the Nebraska Council on Developmental Disabilities. Just one question unrelated to your presentation. Any other questions? Please feel free.
I'll be here through the presentations this afternoon if anybody does have a question.
Absolutely. Thank you, Joni.
All right. Thank you.
Now, moving on from Joni, I want to introduce, as I did earlier, Tom Arnsbarger, who is legislative aide to Senator Lynne Walz. Senator Walz's office took as you noted with Joni's presentation, a significant role in supporting the initial efforts to move the planning around an Olmstead plan forward and to help ensure its completion. So with that, I will turn it over to Tom please go ahead. Please, Tom, go ahead.
Yep. Thanks, Mark. I appreciate it. So for the record, for those of you that don't know me, my name is Tom Arnsbarger. I was a former legislative aide for Senator Walz, now research analyst. Some of you may know that she ran for the chair of the Education Committee the other day. She won, and so she's now the chair of the Education Committee, but I helped, my job was to help guide her and her agenda throughout the past few years as legislative aide. I myself, I was, just for a little bit of background, I was born in Omaha. I have a disability myself. I am hearing impaired. So, and it would not have been found out were it not for federal legislation that required hearing testing for those entering into elementary school. So my parents had no idea that I was hearing impaired from a young age until I went into school and I had to be tested for it. So I am acutely aware of how beneficial that disability legislation and disability advocacy is. For my boss, a little bit of background on her and some of her past work. She's from Fremont, grew up as a farmer's daughter, but she worked for NCORE in the past as a service provider, living with 4 women with disabilities and just helping them with daily tasks. And then she graduated to become a regional director. And so she is very passionate about disability advocacy and the work that we can be doing and how we can improve in all of these different areas. She then went on to become a teacher and then a realtor. She put 3 kids through the Nebraska education system, and now she is here today trying to do everything she can to give back to all the people that gave her so much. She's really great to work with. Many of you know already, but I love my boss. She's awesome and great to work with. But I'm here today to talk about some of the, I believe Mark wanted me to talk about legislative advocacy and some of the work that goes in behind the scenes and some of the work that goes to get a bill such as this one passed. And so I'm here to hopefully pull back the curtain a little bit and let you see what we did to put down the groundwork and move forward on this issue. So part of understanding this legislative process, it's part of understanding the legislative advocacy, and I could go on forever about this. There's so many different parts about this, from campaigning to make sure the right individuals are in office, to getting the policy drafted. And if you have any questions about any of the jargon we use, sometimes us here at the legislature are kind of in our own little bubble. And so please feel free to throw anything in the chat and I can address that. But part of the legislative process is we write the bill. The senator has 10 senators at the beginning of session have 10 days to introduce it. They get referred to a committee, and the committee hears the bill and they hear all the issues that might be a part of it and where we could potentially improve, and then from there, the committee votes on the bill and it advances to general file. There are 3 phases once the bill is passed committee on the floor: general file, select file, and final reading, and then before it goes to the governor to be signed. So part of what I will be talking about today, I think it'll be helpful to know that process. Also, each senator gets a priority bill, and the speaker gets a number of priority bill designations that they can choose to say, hey, I think this bill should be heard this year, and we need to have a discussion on the floor as to whether we should sign this bill into law. So that really limits the ability, and so we have to prioritize what we want to be heard each year. And part of that, so what we have to do is we have to come up with a strategy and pick of all of the bills that we introduce, what we want to move forward and really push on. And so when we go into, we knew this was a big issue for us and we knew this needed to move forward. And so part of my job is to set the legislative strategy on each individual bill. So that entails helping write the introduction for the senator and making sure we have our agenda set and building a strategy around it, finding support from many of the people, and that involves communicating with many of the people that are on this panel and Diane Dallaire, and getting other committee members involved and educated beforehand if possible, but definitely at the committee process, making sure we have our ducks in a row. Identifying key senators who could be supportive. There are many senators in this body from all diverse regions, and some of them have family members with disabilities, and they might also want to be a part of this process. Then once we're in front of the committee, I mean, there's a strategy there, right? Between, you want to appeal to their ethics. This is the right thing to do, and we need to move forward on this issue. You need to make an emotional argument, and that comes from many of the testifiers who are not us, who are actually affected by this legislation. And it doesn't, and that can go a long way. There are many that we have to keep a box of tissues ready for many of the senators and many of the testifiers in front of the committee, and they can be long, hard days, but ultimately it helps, that part of it helps address and push this kind of legislation forward. But it's also important because the senator's time is very valuable, that we want to, going in, make sure that we have a limited amount of testifiers if possible, which is not always the case because, you know, we have a very valuable process in Nebraska, and it's a very unique process because we're one of the only states that allow public testimony for all bills in Nebraska. So any person in Nebraska or outside of Nebraska can come in front of the committee and let them know how this legislation affects them and why it's important or why it's not important to them. And it's also, committees can go on for a very long time, and it's important to identify key testifiers. We had a great man who his son was involved in a past circumstance at BSDC where they had a lot of issues, and he came in and gave very passionate testimony about how this affected his family and how his son died because of the lack of investment on the state level in this area. Another huge part of this is making sure that your statement and your testimony is prepared correctly so that you can advocate for the issue in the best way possible and educate the senators in the small amount of time that you have. Now that can be difficult, and so part of my job was to help coordinate the testimony so that going in that we had a clear directive and they weren't getting confused or hung up on small issues that weren't necessarily important to the overall task at hand. And so with Olmstead, it's making sure that they understand that it was a Supreme Court decision. Our state has to move forward on this issue, but also that we are not forcing people into inclusive sites that they don't want to go into. And that's part of the requirements of the Olmstead decision by the Supreme Court. The services need to be appropriate. The affected persons do not oppose the services, and it fits within the state budget, for lack of a better term. And then what are we trying to change in legislation? And then, so with that, I wanted to share the screen really quick so I could make some comments on the past history and how we got involved. So in 2016, Senator Kathy Campbell, for the record, Senator Walz joined the legislature at the beginning of 2017. That was ironic. That was at the time that Senator Kathy Campbell was term limited out of the legislature. And she, as I understand, was a huge disability advocate in the legislature and played a big part. So inevitably, when a senator leaves who has been such a huge part. Oh, I'm sorry. Hey, Mark, quick question. Is me sharing the screen a problem for the interpreter?
I don't believe so, but
okay. Good to know. So yeah, so part of the big, what I'm saying is somebody needs to take up that mantle, and there was a gap there. And Senator Walz was one of the perfect person to fill that gap. And but Kathy Campbell introduced LB 1033 to develop Nebraska's Olmstead Plan. That went a long way towards drawing attention to the issue and making sure that people were aware that this is something that we weren't prepared for. It was a Supreme Court decision handed down 20 years ago, and Nebraska really hadn't done much on it since then, and we didn't have a comprehensive plan for people. It required DHHS to convene a team, required DHS to consult with other agencies, appoint a stakeholder advisory committee, and we wanted it to be comprehensive and specific. That was signed into law by the governor. And then, so 2 years later, 2 years later, Senator Walz introduced LB 800 and that adjusted her language to require the department to hire a consultant to assist with the development of the strategic plan. Part of this ultimately was indefinitely postponed, which means it failed and it failed to pass, but we made a lot of progress and drew more attention to it. But part of the problem with that is that because it failed, the date sunsetted, and ultimately the bill was not passed in time, and the plan and DHHS did not meet the required completion date for the plan. But part of the reason why it failed was also the committee structure and who was in charge of the committee. And for lack of a better word, it was not, the committee chair was not favorable to introducing this legislation because at that time, Nebraska was under a very tight budget circumstance. And that was one of the main concerns, is that do we have the money to pay for it? That could be argued one way or another. Some people might say that it was really what are our priorities? It was really a question of what are our priorities and where do we want to put our money in the long run? Yes. And so moving up, the council, this is where the council came in and was very helpful and helped get that on the road. But there was still the issue of the fact that Nebraska was out of compliance with statute, and we had set a date and it had not been met. And so we came back and in 2019 and introduced LB 570, which was very similar to the last plan, and with a few exceptions. One of them, which was brought to our attention, was that the advocacy groups that were required to provide guidance on the document did not include the Deaf and Hard of Hearing, Commission for the Deaf and Hard of Hearing. So we added that as a requirement. Another part of it, which we wanted to include, was clear statutory language that included the Department of Corrections, the Department of Labor, the Department of Education, and long-term care ombudsman to really exemplify in statute that these departments need to be involved in each part of the decision-making process during this time, because this is a comprehensive plan and it's not entirely incumbent upon the Department of Health and Human Services to do everything, because the Department of Education still provides transition services to those with autism, and they provide special education funding, and making sure that we are, and the Department of Transportation needs to be aware of a lot of these issues, because transportation and mobility is a huge issue for this community. And when we implement public transportation, how are we making sure that we are considering everybody's needs? So we wanted to make sure that each department was involved. Yes. And in addition to that, we moved the strategic plan due date to be completed back a year to allow the department more time to deliver that plan. This was for a few reasons. One, it's bad policy to be out of compliance, but two, we wanted to make sure that we maintained a due date. But if we were out of compliance, that also that left the state liable to be sued should it not be in compliance, and somebody were to bring that suit. That would be that could potentially be one of the things that were brought up. Yes, so as I said, yeah. And now what else? Okay, where was I? That's about all I had on that area. But I guess now I wanted to talk about where we could go moving forward. It's our job as the people who introduced it, but also as other senators in the body's job to help, and just an advocate job to make sure that the committee members of HHS, the chairs of the department, chairs of the committees, are aware of this legislation and how that they can impact and be conscious of their decisions and how it impacts people with disabilities going forward. It's a continuing education process, and that's important to be aware of, because just for the reasons that we put all those departments in the bill to work together to make the plan, the chairs need to be aware of that as well. And then also just to work with the HHS, and that is to provide some feedback, that is to sometimes criticize and sometimes ask the hard questions of, I don't like this goal, sometimes saying, what's the best way we could do this? How can we help as a legislature? What do you need from us? And saying, what can we do better? And a lot of that falls back on the part of educating the chairs and making sure that they know that it's part of their responsibility as well too. And then continuing to advance positive disability legislation. For example, we remain on the Health and Human Services Committee. Senator Walz remains on the Health and Human Services Committee. We are introducing a number of new bills this year, and some of the same bills. For example, one of them is a bill to move the age limit to when the Department of Education needs to begin creating a transition plan for those with disabilities from 16 to 14. Because what we have found is that we could be more prepared, and some schools while many are addressing it early and before they turn 16, it'd really be advantageous to start at an earlier age. We are introducing LB 468 again, which is a bill to prohibit long-term care facilities from moving under the Heritage Health Program, which ultimately protects the funding and protects the funding for those programs. So there are a number of issues that throughout the legislative process that disability legislation touches on, and we need to continue advancing those. So, and now that especially as chair of the Education Committee, we have a lot of work to do as far as special education. I saw
Froze up.
We may have.
I might have cut out there a little bit.
We lost you for a sec, Tom. So
yeah, the internet's not great here right now. But yes, just moving forward and paying attention is one of the biggest issues that we could bring forward. That's all I had for you right now. But Mark, did you see any questions?
not yet. Are there
That I might be.
questions for Tom? I had a request for you to repeat your last sentence or two of what you were saying about special education.
Oh, yes. Senator Wishart introduced a bill to increase the amount of state aid to the percentage amount that state gives in special education funding. And part of the reasoning for that is because that will help draw down more federal funds, because the federal government brings a percentage match to each dollar that we provide as a state. And, you know, there's a number of different arguments for that. For example, it will help reduce the property tax burden in a lot of these rural communities because the cost of disability education can be very high. and that leads to higher expenses, more for the schools, more needs, which makes it have to be covered by the local areas. But then, and if we invest more as a state into special education, that increases the amount of money that we could draw down from federal funds.
Thank you. I have a question. One of the attendees is wondering if there's a way to directly follow your progress on these issues, Tom. For example, social media.
Yes. I do know that through the Nebraska legislature website, I believe that if they haven't taken it down or changed to a new system, the clerk of the legislature has figured out a system so that you could be notified by email on specific bills. But as far as following my boss, yeah, I believe we have a Facebook page, and we send out news releases regularly. And yeah, there's a number of ways to be involved. And it can be daunting because there are a lot of bills every year. So
I can just, in terms of my experience, Tom, you can go on to the legislature's website and go to Senator Walz's page, and she provides regular updates there. So that's not a difficult, especially if you
I think
feature the link, in terms of getting to her personal page.
Yeah.
Other questions for Tom? Oh, thank you, Tom. Very much. We appreciate your being here today, and appreciate yours and the senator's efforts in moving Nebraska forward on Olmstead planning. So thanks very much.
Thank you.
There was a question regarding a link to yesterday's recording, and Kathy, you were going to respond to that, or do you want to save that?
All I was going to say is the recording is supposed to be put up on our YouTube channel, which Melanie should have the web address for later today or tomorrow. So it'll be in the next day or two, they'll be up. So Melanie, you could put that in there, I'd appreciate it.
I think Melanie has put it in there several times. So with that, thank you, Tom. Last but certainly not least, I want to introduce again Director Tony Green, who has been in the chair for a few months now. So, but has been a long time associate director within the Developmental Disabilities Division. So he brings a wealth of experience and knowledge to his work, and he will be a key individual in terms of Olmstead planning going forward. And I will be doing his slides. Something about the Department of Health and Human Services and Zoom not playing nicely together. So if you'll give me just a second, I'll get that put up on the screen. Okay. And there we go. See that okay? Tony?
Oh, Mike, there's nothing on the screen.
Okay. I am clearly, okay, trying one more time. You should see it now.
There we go.
They didn't hire me for my technical skills, as you can obviously tell. But anyway, please go ahead, Director Green.
All right, thank you. Well, as Mark said, I would like to first just thank you all for the opportunity, those that are hosting this event, to come and provide some updates. As Mark said, my name is Tony Green, and I'm the Director of the Division of Developmental Disabilities here at HHS. And I do hold the facilitator ownership role, if you will, on behalf of the CEO of HHS for the Nebraska Olmstead plan. So I have a vested interest in making sure that we move this forward, and really, as presenters said yesterday and also today, make this a living, breathing document that we make substantial progress for folks with disabilities. As I think has been indicated in other presentations, hopefully you've had a chance to look at the Olmstead plan. It's available in many places. I know Diane had shared yesterday with Disability Rights, and their page has Olmstead information. We certainly do at HHS on the Developmental Disabilities website have a page for Olmstead where you can find the plan and other documents from some of the various meetings that we've had. What you've heard so far, as far as the plan, we did submit that in December of last year, and really started to put the plan and the progress pieces together this summer and certainly this fall. And so, as Joni had indicated, we're 6 months into the plan. The plan year started in July of 20 and will go through June of 21. My focus today is really going to be giving you kind of an overview of where we're at with that plan. In these first 6 months from July to December, how have things been going? I think as the slide indicates here, folks are fully aware that many of the resources, not only by HHS, but certainly even other partners at the table, have been impacted by COVID, and many of our staff resources and just community resources, people are really focusing on that, obviously for the right reasons. But just wanted to make note there that has put an initial damper on moving some of these forward, but we are working through the Olmstead plan, despite all of the other things going on. Besides, despite schools having to close, us having to divert some of our positions, you see there on the slide, from focusing on Olmstead data. We had to get public health data up and running, and they will be back and working with us on Olmstead data. We certainly have transportation dilemmas across the state that have impacted some of those plans from the transportation side. But again, my goal really today will be to kind of walk through the plan in the 7 goal areas. And so we have 7 goals that have been identified in the Olmstead plan. And I'm really wanting to just provide some high-level education. Some folks have heard some of these messages if they are a participant from the advisory or the steering groups. But want to just give a high-level update and recognize some of the important things that have gone on. But I also want to preface my presentation, and we'll certainly talk about it at the end with next steps, is there's a lot more to do. And so please don't take the presentation as we go through and we talk about the goals and some of the successes under each of those in any way that we are done or that we have accomplished or completed any of those goals. There are many strategies in this plan that need to be addressed yet. And there are also many strategies that are yet to be put into the plan that need to get in there. And again, we'll talk about that more towards the end of the presentation on next steps. So what I'll walk through now is really each of the goal areas and highlight some of the successes that the various entities that are involved in the planning process have reported to the division. So for a point of reference, we reconvened our steering committee this fall. And really our whole point over 3 meetings with them this fall was to touch base and get information from them on progress that has happened so far. As mentioned in I think Joni's presentation, that TAC continues to work with us, and they are working to evaluate our initial progress these first 6 months, and are presenting us with a progress report that will not only identify some of these highlighted accomplishments, but it will also identify areas that we have yet to focus on or haven't been able to start yet in these first 6 months, and certainly challenges to add additional focus areas into the plan. But goal 1 in the Olmstead plan is really focused on folks having access to individualized community-based supports to meet their needs and preferences. Again, kind of a large overarching goal statement. And then on the next slide, you will see that there are some accomplishments that we've identified under this slide. There's actually 11 different strategies in the plan that kind of roll up under this goal. But some of the ways that we have begun, at least in these first 6 months, to focus on making sure that folks have their needs met in the community. On the DD side, you'll see there under those waivers, there was an addition of 11 new service coordinators that has occurred. We also, on the DD comprehensive waiver, we began making some offers from the wait list in September, 100 to be exact, and can update you today that has now, we have 93 of those offers have been accepted. So since September, 93 folks have been given funding offers from the wait list to go on to the DD waiver, and so far I've got 93. So 7 more, and we'll get to that 100 slots that we began offering. I Serve Nebraska is also another project that has been kicked off at HHS that will have an impact on this goal area. Would encourage you, again, there's a lot in this plan, and many things impact larger than just my division at DD. And so there's other agencies that would have answers to certain things, but on this one, I would encourage you to go to the website. We do have information out there about iServe. The way that I generally explain it is that it is a supercharged Access Nebraska, if you will. It really will be a fully integrated portal for Nebraska for all eligibility and benefits programs. Now that certainly is a long-term goal, and you will see that phased in over various phases in the next several years. And another accomplishment that was submitted by the group by the steering committee for the plan was that the Nebraska Injured Brain Network incorporated and is finalizing a website for folks with brain injury and family members. Again, just some high-level accomplishments that were identified under that goal, and certainly more things to come, but there is some good work being done towards goal number 1. The second goal in the Olmstead plan really is focused on folks having access to safe and affordable, accessible housing in the communities in which they choose to live. And so kind of looking to the next slide, there are 10 strategies that are in the plan that kind of roll up again under this goal of housing and access to housing. And so some of the accomplishments that the group has brought back to the table this fall that they've been able to accomplish is a housing administrator position. That's in our Division of Behavioral Health. That position was filled to begin coordinating and really focus on housing. So there is a full-time position doing that. DBH also saw an increase. Previously we had 300,000 and that was increased to 800,000 for fiscal year 21 to address housing. A new website, housing.ne.gov that you see there, was created in partnership with Assistive Technology, HHS, and NIFA. And then in some data there, in fiscal year 2020, the Division of Behavioral Health did provide rental assistance to 1,078 individuals. So again, not an accomplishment of all 10 strategies by any means, just a highlight of some of the things that have occurred in these first 6 months under that goal of housing. And certainly much more will be coming out of that group and the housing committee that works on that goal that we'll talk about at the end. The third goal that's in the plan really focuses on folks receiving services in settings that are most appropriate to meet their needs and preferences. And Mark, if you want to go to goal 3. And then we really have taken the plan then and under that overarching goal that all folks with disabilities have appropriate settings, there's really 3 subcategories that this focuses on. And one is to look at diverting admissions to and facilitating transitions from institutional care. It also looks at diverting admissions to segregated settings and strategies to look at justice involvement and homelessness. So on the next slide, you will see this, this goal actually has 21 different strategies that have been identified in the plan within those 3 subsections. I think some of the accomplishments that have occurred in this initial plan year, we continue to, on the developmental disability side, have not had any new admissions to the Beatrice State Development Center, which is the state-run intermediate care facility. Mosaic has reported reduced admissions to their intermediate care facility. In fact, from fiscal year 19 to, from 19 they had 14 admissions, and they have dropped that to 6 admissions, and so a 50% reduction for them. They have also increased the number of folks who have been discharging from their ICFs to waiver community-based services. And that, again, that's specific to just the ICF side of the house, and this is larger than just those facilities, but just some accomplishments for this specifically to the ICFs. The other thing in the Division of Developmental Disabilities, we've implemented the Inter-I Pediatric Home Care Standardized Assessment for Children. And so short version of all of that, this is the tool that we've been talking about for nursing facility level of care for children that folks on the aged and disabled waiver are very familiar with. And so we had been working on getting all of that cleaned up and implementing a new tool, and we launched that this month in January, and we're now going to work on implementation of the adults, both the nursing facility level of care tool and our intermediate care facility level of care tools in 2021. So more to come on that. Excuse me. Goal 4 really focuses on our education and choice and competitive integrated employment. Again, a couple different subcategories within that goal, focused on the education and then separately focusing on the integrated employment. Accomplishments that have occurred under that goal thus far. Again, this one has 21 strategies that roll up into the 2 subsections. And Department of Education, in their meeting with us in the steering group and the advisory committee, talked about the early childhood liaison that they have that is to address kind of the preschool to prison pipeline. They have been providing training both at the regional and the educational service unit level to really teach or train teachers and others in the education system, kind of the implications of the impact of suspension and expulsion on students. That's kind of what's focused on in that accomplishment there. The Jobs for America's graduate program provided 266 students with a 98% graduation rate. There's been an increase of 21% for persons served by vocational rehabilitation, and they have hired 2 additional business account managers to assist with outreach to employers. So those were some of the accomplishments that we were able to identify under Goal 4, specifically with education and VR. Excuse me. Goal 5 is really focused on access to affordable and accessible transportation. As you can imagine, and I think was alluded to in one of the opening slides, this certainly has been had a huge impact with COVID. On the next slide, you'll see that this does have 11 strategies that roll up into this goal. Department of Transportation has been at the table with us this fall as we came back together to kind of gather some of those updates. They have recently upgraded their website at nebraskatransit.com, and you'll see another accomplishment they're reporting with the Ponca Tribe and City of Norfolk and Norfolk Public Transit working on a joint transit facility in that area. There are transportation folks that have been a part of the committee certainly have indicated in their survey of transportation companies across the state that even from February to May, I think they were talking to our group that their survey showed that there was a 75% impact in rural transit being reduced, that 75% of the agencies saw a decrease in ridership, which I think everyone kind of knew and assumed was happening as a result of people isolating, quarantining, kind of limiting their community and social engagements. And so transportation is one of those areas, I think, when we talk about at the end, the work groups and some of the movement that we'll be working on into 21, that we're really going to have to look at what the impact has been. Department of Transportation has been using CARES Act funding. You know, one of the things that we've all been worried about through the pandemic is, will the service delivery system still be sustainable and up and running when folks are ready to come back to more of a normal, if you will, routine? And so they have been using CARES funding at transportation to fund and help them retain staff. In addition to using some of that to purchase some ADA compliant vehicles. So there is some work being done over there to not only try to keep the transportation companies, certainly in rural areas, viable, but also when we get back up and running, I think we'll begin to try to tackle some additional strategies around that. Goal 6 is in the plan, really focuses on folks getting services and supports that reflect data-driven decision-making and improvement in the quality of services and enhance accountability across systems. So kind of a lot all rolled up into that. This one has 15 strategies that are under this goal. And a couple of the highlights that we pointed out on the slide here for you. There's been trainings to mental health providers that have focused on working with children with low cognitive disorders. There was, I think, 162 mental health providers that attended these trainings that were put on. We did those in Lincoln, Omaha, Kearney, North Platte, and that was, we were able to do some of that through the System of Care grant. I hope you have all heard about person-centered planning. I know in our partnership with the Nebraska Council on Developmental Disabilities, we are really rolling that out and trying to get as many people across the state trained and in the mindset of person-centered planning, so we can get that foundational piece there for everyone and then really begin implementing the person-centered planning across our state. So our website certainly has a lot of information about person-centered planning. We have been training across the state. Much of it has been obviously web-based at this point. It's a little different than we had initially planned in our contract with Mark Friedman, who is doing that training under the DD Council. And then the last accomplishment on this slide that we put on here for you is that Medicaid, long-term care, our Medicaid division did implement a new rate methodology in July of 2020. And what this really did was begin to decrease the disparity in rates between facilities and Medicaid beneficiaries. So again, just some of the work that's being done on Goal 6. And then finally, Goal 7 is really around folks receiving services and supports from a high quality workforce. This goal has 5 strategies that are addressing a high quality workforce. And some of the accomplishments that we've looked at thus far, because this certainly is going to be an ongoing challenge for us in the system to make sure that we have a qualified workforce. There's a significant shortage of a direct care staff, and we really have to invest in getting that fixed. But some accomplishments, the DD waiver, so we were able to, with funding, funding that we had received this last year, bring the rates that are paid to DD providers under the waiver up to the full rate model. So we had a rate study that had been done a few years back, and given the current budget, we weren't able to fully fund the rates that model said we needed to pay providers. And we were able to, with the funding that we received, which was about 3.7 million specifically for provider rates, in June of 20, we were able to put that into our new fee schedule, and all of the rates on the DD waiver are now at least at fully funded according to that model. Now, you will hear I'm always that model was built on costs from a few years back, and so it's always behind, but we at least got it caught up to where the study was done, and we will be embarking on a new study in the near future. Another strategy, or excuse me, accomplishment that was identified by the group under this goal was Career Pathways Advancement Project, and that's with vocational rehabilitation, implementing that, and it's creating a certified nursing assistant program with students and adults with disabilities. So that was, again, very high level, just some identification of work that has been going on as it relates to the strategies in the Olmstead plan. What I want to talk about on the next slide is kind of where are we going to go from here. And so as everyone has alluded to this being a living, breathing document, it's now in 2021, my goal that we're going to begin making this the living, breathing document. So right now, to date, since July, it really has been the plan that was submitted in December of 2019. And we have been focusing on reconvening all of the partners that are required to be at the table and anyone else willing to be at the table to get those updates and at least give information back to TAC, who is providing that initial report to us that says, how are we doing so far? You know, have we been successful at getting people to the table? Have we begun progress on these goals? And where might we give Nebraska some advice of where they should focus? And so that is currently being worked on, and we will have that out shortly. They absolutely have worked on their draft, and we've seen that, and we're getting ready to finalize that, and we will be sharing that with our steering group and our advisory committee shortly. Again, that's just an internal report that we had requested to just again identify some of those things I just talked about, but we will share that. We are also working on, and you'll get this out shortly, but there will be an Olmstead email address. And so I want one single address that folks can just send questions to, criticisms, suggestions, accolades, anything that's related to Olmstead. We kind of want to get one place that folks can get that to the department, to us that are facilitating the Olmstead plan, so that we can begin to take that feedback and incorporate that into our planning efforts. Our project manager, and you'll see on the next slide Matt's information, but in our division here in developmental disabilities, we've identified a project manager who will have Olmstead as their primary role to support me in making sure these efforts do move forward. Matt is beginning to identify work groups that will begin meeting here in 21. So we've tried to, initially we met this fall to just with large groups to say, how are all the different agencies doing? We know folks are busy with COVID, but have you done and been able to work on Olmstead activities? And thankfully everyone has still got it on their mind. And as you've seen in some of the slides, we've been able to make some accomplishments, but there really now in 21 needs to have some very strategic and targeted conversations about specific goals in the plan, and how are we going to move some of these things forward? And we need to begin to put some of that action in motion, if you will. The steering group, again, the steering group is the smaller of the group, which is kind of the folks that were identified through statute as requiring to be a part of the Olmstead planning group. They will be meeting quarterly in 21, and they're working to get those scheduled, hopefully in late February. And then the larger advisory committee that I think many of you who might be on this call will continue to meet quarterly in 21, and Matt is actively working on getting those scheduled for you all. So then what happens after that, and I think this maybe was in some of the other presentations too, is TAC is going to assist us to develop a report to the legislature. So as Thomas had indicated in his presentation, we will be continually updating the legislature on Nebraska's progress with Olmstead. And that first report is due at the end of this year on December 15th. And so TAC will be with us along the way and working on collecting all of the information from our advisory groups and steering groups, and then submitting a report to us at the end of the year. This slide will have Matt's contact information. Again, Matt's the project manager for the Developmental Disability Division, specifically for Olmstead. And I think once we get to the work groups and some of the reconvening of advisory and steering committees, we really will begin to start to move some of this forward, and I think begin to change the plan. I fully envision that we will have a updated Olmstead plan that we will be submitting after we complete this year. I think if you were able to attend any of the other presentations, or certainly if you are a member of the advisory committee or steering committee, there's a lot of work to be done with this plan, and there's a lot that needs to yet go into it that we have to start working on. And so you have my commitment to move that forward, to truly make this a living, breathing document that will have data, will have measurements, will become clear. I think we have opportunity to make this a much more robust plan that we will get through that. So that's my presentation.
Thank you, Tony. I do have some questions for you, and I think Matt was willing to step in as well. And Matt also listed his contact information in the chat for those who are interested in that. One question that came out very early was one of the attendees is wondering what agencies are involved in the housing committee that you referenced early on, Tony. and if there are any individuals with disabilities that are involved in that committee. I believe that's housing and mental health specifically, but if that wasn't stated, but that's about the time the question came.
Yeah, and I certainly, if folks want to, there are many folks on that housing committee. I don't know if I want to read all of the different entities. I certainly can. It involves obviously department folks. It involves local housing authorities from different housing authorities across the state. NIFA, the Nebraska Investment Finance Authority, is on that housing committee. Department of Economic Development, other HHS divisions. And as far as the specific question of are there consumers with disabilities, that's something that I'm working with on the housing coordinator side to get that addressed.
Thank you. Thank you. Another question. There are just a few, but have there been efforts to develop SAH through tax increment financing or other mechanisms to develop new integrated housing, as there appears to be a shortage of safe housing for persons with low incomes?
Great question, and I didn't preface the Q&A with, yes, I am the director and the owner of the plan, but I am certainly not a subject matter expert in every element of the plan. And that certainly is a very good question that certainly our housing committee can answer. And I know, but I will certainly take that back and I don't want to misspeak for some of the good work that they are doing on the housing initiative, that there is more work to do on housing, absolutely.
Okay, thank you, Tony. And finally, and how are people with other disabilities being addressed in housing other than behavioral health, which you had noted there are some areas where there's improvement being shown, but there's a question as to what other areas are is housing being looked at this point?
Yeah, I think my answer would kind of be similar in that while there is an increase in money that's being certainly allocated to our Division of Behavioral Health specifically for housing, which we are very appreciative of and been able to do some work. I think there's been reports at the advisory and steering committees about a project that was able to be done with that funding that does increase housing units, affordable housing units, and they also have been able to increase the vouchers that they've been able to do. But again, there is more to be done, and I think the work group will begin to tackle some of that now that we are making that a priority for folks.
And I have the sense that Matt is really trying to get himself heard, but is unable to speak up. He has put, well, and Heather is also putting information up on the housing work group is just getting up and running and discussing more populations than just mental health. So,
yeah, I apologize. I wish I could attend all the different committee meetings that go into the Olmstead plan. And I haven't been able to sit in yet on the housing one, but do plan to do that in 21.
But well, some of your staff are upstanding, are joining in your stead. We're running a little short on time. Very quickly, an individual wanted to know how many folks are on the DD waiting list at present, because that seems to be been a moving target of late.
Let me. 2,964 for the DD wait list.
Thank you. That was what I heard. I know we're running short on time, but one last question. When will the rebase for provider agencies be started, if it hasn't been started? And is this something that occurs routinely, regularly, or at what frequency?
Yeah, great question. So We are required under the waivers with CMS. CMS is the Center for Medicaid Medicare Services, the federal Medicaid program that funds us. We're required to rebase our rates every 5 years. But Nebraska has implemented a process, at least on the DD waivers, and we will begin to work on this in the aged and disabled waivers as well. We require an annual cost reporting now that will begin this year with the DD providers, where they have to submit cost report data to us. And what that does is it gives us the information that we normally would get when we rebase in 5 years. We're going to get it annually so that the state can assess that to see if we want to go earlier for a rate rebase. So you don't have to wait the 5 years, you can do it more frequently. And we are beginning to collect the data this year to help facilitate those discussions with providers of if we need to do it sooner, if costs, change drastically in some area.
Thank you, Tony. With that, I'm going to thank Tony Green, the Director of the Developmental Disabilities Division at NVHHS, Joni Dulaney with the Nebraska Council on Developmental Disabilities, and Tom Arnsbarger from Senator Walz's office in the legislature for their, number one, excellent presentations, and two, for the great work they're doing on behalf of our citizens with disabilities. Given we're at a very late point, I'm going to throw it back to Kathy and thank all of you who attended. I hope you enjoyed this wealth of information as much as I did, and thanks for being here. So, Kathy?
I'll make this really quick. I just want to thank Tony, Tom, and Joni. And I want to thank everybody who tolerated our interpreters getting unspotlighted. And so we kept losing them, but I kept trying to fix them. Anyway, I just want to let you know that our next session will be on February 4th. It's on Centers for Independent Living, What's at the Core, and it'll be from 2:30. And if there's a topic you would like to see us do a session on, please feel free to reach out to anybody in the organization that I mentioned earlier.
Yes.
So everybody have a really good day.